Welcome back. This is one of the most important lessons. As we have taught this course over the last 10 years, the students have found this to be very important because 51% of the US population at some point in their life will struggle with a mental health issue. And on average, it's 11 years from the time a child first experiences problems to they actually get help. So whenever I see a new patient or a new client, I'm always thinking about the 4 circles of brain health. They're biological influences, psychological influences, social, and even spiritual. So I want to talk about that. Whenever I try to understand anybody in my life that I'm trying to help, I think about these 4 circles. So the biological one is how your brain actually physically works. So the health of your brain. It also goes with your physical health. I mean, did you know if your hormones aren't right, your brain's not going to be right? Nutrition, exercise, sleep, hydration, how much water you drink, your hormones, and we know during adolescence the hormones are surging, and that can cause changes in how you think and how you feel. What's your blood sugar level like? I treated a very famous actor once who'd get into all sorts of trouble, fights and things like that. And when I tested his blood sugar level, it was really low. And so the treatment, so he wouldn't get arrested anymore, is he had to eat 4 times a day healthy food to keep his blood sugar balanced. Are there supplements you take? That'll have a biological influence. Genetics, what's your family history? As height and hair color and eye color runs in families, so does temperament and anxiety and depression and drug abuse. Have you had a brain injury? I mean, that's clearly a biological influence on your brain. Do you have allergies to gluten, to wheat, to grass? Have you been exposed to any toxins? Had any infections? Physical illnesses, medications you're taking. So these are all the biological influences that affect people. But in addition, there are psychological influences that make us who we are. How do we talk to ourselves? Our self-concept, our body image, the environment we grew up in, our development. Have we had past emotional trauma, past successes, past failures? What's your sense of self-worth? Your sense of power or control over your life. The less control you feel you have over your life, the more likely you are to be anxious or depressed. I think generational histories are really important. So all of my grandparents were immigrants, and there tends to be psychological issues if you are first, second, or third generation American. Did you grow up in an alcoholic family? Were your parents survivors of trauma like the Holocaust? Have you experienced grief and loss? What's your sense of hope? So all of these are psychological factors. There are also social factors. What's the quality of your environment, your home life, your school life, the sense of connection you have to families, friends, your community? How's it going at work? How's it going at school? What are your relationships like? What are the sort of current stresses in your life? Health, finances, your current successes or failures. Do you have enough information to deal with the problems that you have? And what are the health habits of your family and friends? One of the most interesting things that your health and your longevity, how long you live, is highly dependent on the health of the people you hang out with, because habits are contagious. and then a spiritual sense, which a lot of people don't talk about because it makes them nervous. A lot of psychiatrists won't talk about it, but to me it's very important. And it's not just your belief in God, it's why do you care? Why do you think you're on the planet? What's your deepest sense of meaning and purpose? Why does your life matter? And people who have a sense of purpose live 15% longer than people who don't. What are your values, your morals? Who are you accountable to? Do you believe you're accountable to a higher power, or we're just here by random chance? What's your connection to the past generation? So for me, it's to my grandfather, who I was named after, who was my best friend growing up. I'm still, even though he died many years ago, I'm still very emotionally connected to him and want him to be proud of me. And connection to the future. So for me, it's my 4 grandchildren, that I want them to do the best they can. I want to be a good role model. Your connection to the planet, because I know we have to keep it healthy in order for my grandbabies and their grandbabies to be healthy, and then a connection to a higher power. And 80% of people in the United States feel like they have a deep connection to a higher power. So I think it's just important to understand it. So the brain struggles, and it can struggle in any of those 4 circles, and people can end up with mental health issues. So they're real, and they can devastate people's lives when people are not treated appropriately. All mental health challenges have a brain-based biological component, but they also have psychological, social, and even spiritual components. I often say, I've been a psychiatrist for a very long time, that nobody really wants to see a psychiatrist. No one wants to be labeled as defective or abnormal or crazy, but everyone wants a better brain. So what if mental health was really brain health? And it's something I deeply believe, as does Dr. Payne, that with a better brain comes a better mind, comes a better life. But never forget, it's not just the biology of your brain. There are bio, psycho, social, spiritual causes of mental health issues, and the interventions are biological, psychological, social, and spiritual. So a biological intervention could be exercise, eating right, supplements, medication. Psychological interventions could be killing the ants, which we'll talk about, not believing every stupid thought you have. Social interventions could be doing group work, volunteering, getting outside of yourself, learning how to be more effective in relationships. And spiritual interventions is really thinking about what's your sense of meaning and purpose. Why are you on the planet? How can you contribute in a positive way to your family, your community, your country, your world? Brain struggles can be complex. Your brain is the most complicated organ in the universe. We talked about the 4 circles of illness and health. So understanding anybody, it's understanding those circles. Every issue we'll discuss has multiple types. So we'll talk about depression's not one thing, ADD, autism, bipolar disorder, and addiction. They're not single or simple disorders. I've written whole books about that. If you want to know more, read Dr. Payne's book, Change Your Brain for Under 25, or my book, Change Your Brain, Change Your Life. We go into a lot more detail about this. The third concept is almost all of us will have mental health issues at some point in our life or know someone who does. We all go through tough times. If your symptoms impede your ability to function or be productive or feel happiness or joy, then it may be time to seek help. The strategies in this course can help you feel better. Dr. Payne and I purposefully developed this course to help decrease anxiety, depression, improve your focus, deal with past trauma. So this is what we teach our students and our patients. Here are just some examples. It's not an exhaustive list. It's not everybody of people who have mental health issues, depression, bipolar disorder, PTSD, post-traumatic stress disorder, eating disorders like anorexia and bulimia, obsessive-compulsive disorder, other eating disorders, ADHD or ADD, Tourette's, which is a tic disorder, anxiety disorders, conduct disorders, and oppositional defiant disorders. I'm going to talk just a little bit about each of these because if you have one or you know someone that does, there is hope because all of these are treatable. So depression is very common, affects 7% of the population at any given point in time. So that's over 20 million people in the United States. It's highly treatable. The main symptoms are you feel sad, blue, negative, hopeless, helpless, guilty, worthless. You cry easily. There are lots of automatic negative thoughts, what we call ants. You just don't feel interested in things that usually bring you pleasure. You don't have a sense of happiness or joy. Your sleep can be disrupted. You may wake up in the middle of the night and have trouble getting back to sleep, or you can't get to sleep, or you sleep too much. Your appetite typically is less and you lose weight. There's a winter depression called seasonal affective disorder or SAD, where you're just hungry all the time. It can be associated with suicidal thoughts or behaviors. Your energy can be really low. Now, all of us have bad days. All of us have times when we feel sad. And 50% of the population has felt suicidal at one time or another. So you're not odd or weird, but if the thoughts come and stay or you've tried, that's a sign you need to get help right away. It's if these symptoms come and stay for 2 weeks or longer, we say you have major depression, and it's important to get treated. All psychiatric illnesses have multiple types. So, for example, if you're depressed, you could have underactivity in your brain and be depressed, or you could have overactivity in your brain. You could have trauma and have one of your temporal lobes hurt, or you could have your cingulate work too hard. So the really important point is not everybody who's depressed has the same brain. There are multiple types. That's true for everything we're going to talk about. People who are depressed, their deep limbic system tends to work too hard. And what we found is exercise helps. In head-to-head studies, exercise versus an antidepressant, at the end of 12 weeks, they were equally effective. Brand new study. The number of fruits and vegetables you eat have a linear correlation, which means they're directly correlated to how happy you are, up to 8. So if you compare people who eat 2 fruits and vegetables a day to 4, the people who eat 4 a day are healthier than those who have none or 2. The people who eat 6 a day are happier than the people who have 4, 2, or none. And the people who have 8 a day, fruits and vegetables, are happier than 6, 4, 2, or none. So that's what I mean by a linear correlation. Your diet matters. Put more colorful things, not Skittles, but colorful fruits and vegetables. It'll just help you feel better. You want to kill the ants. We're going to talk about that. Automatic negative thoughts. That's why you see an anteater on the screen. Healing smells like lavender can be helpful. Learning to get along better. So forgiving people in your past that have hurt you, spending time with your parents, spending time with your friends can help. Certain supplements have been found to be helpful for depression, like folate, which is a B vitamin, omega-3 fatty acids that you get in fish oil, and SAMe. Again, it sort of depends on your type, what's the right supplement, although folate and fish oil for everybody. And then antidepressant medication if you need to see a mental health professional or you get it from your family physician. Bipolar disorder, less in the population, 1%, highly treatable, and it's people who basically go between two poles. They have times when they're normal, times when they're sad or depressed, and times when they're flying high or manic. So that's why we call it bipolar. It's because they go between two poles. So times when they're sad, blue, helpless, hopeless, worthless, can't sleep, to normal times, and then manias, their thoughts are racing, they're very impulsive, they may become hypersexual, hyper-religious, incredibly impulsive, spend money, they don't have grandiose, think that they're much more special. I mean, you are special, but much more special than you really are. Sometimes it's associated with hallucinations or delusions. I can't tell you how many people I've treated who thought they were Jesus Christ or the Blessed Mother or KGB agents or famous billionaires. And then it cycles down. It's very important to get this treated. Often have trouble focusing, pressured speech. It's like that they don't take a breath. Can have cycles of anger and irritability, and so on. Very important to get this treated. What we see on scans is often too much activity, especially when they're in a manic phase. So the treatment for this, medication is often very important. Actually, with a salt called lithium can be helpful. Fish oil, exercise, and a healthy diet, especially a diet called a ketogenic diet, has been helpful to balance moods. What about people who have OCD or obsessive compulsive disorder? Here we're looking at the brain from the side. It's where their cingulate gyrus, you see that racing stripe, works too hard, low levels of serotonin, and that little mouse on an exercise wheel and the mouse can't get off. They have recurrent, obsessive, bad thoughts, like I hurt someone, I'm gonna hurt someone. They have really just terrible thoughts that go over and over in their head. Compulsive or repetitive behaviors like taking showers, washing their hands, checking locks, avoiding stepping on cracks, checking, spelling, counting, cleaning. They tend to be worried, rigid, inflexible. If things don't go their way, they can get really upset. But there's treatment for it. Behavior therapy. So if you can prevent yourself from giving into that compulsive behavior, what you're doing is you're strengthening your prefrontal cortex so it can calm down your cingulate gyrus. Supplements that raise serotonin like 5-HTP or saffron. Certain medications that raise serotonin like Prozac, Paxil, Zoloft can be helpful. Exercise and a healthy diet. But for this diet, don't go on a high-protein, low-carbohydrate diet. That will actually make you more obsessive. Eating disorders. So anorexia is where you basically stop eating. You feel like you're fat even when you're underweight. Your body image is distorted. You refuse to maintain a healthy body weight. You seriously cut calories, excessive exercise. Often we see a high anterior cingulate on the scans. BMI should be between 18.5 and 25. So BMI is body mass index. It compares your height to your weight. Obviously, being overweight is not good for your brain. Being underweight is not good for your brain. Your brain uses 20 to 30% of the calories you consume. And if you're not eating enough, you won't be able to think, and you're not going to provide the brain with the nutrients it needs to develop properly. So it's critical to get anorexia treated. Bulimia is in the same family, but there tends to be a lack of control over eating. You might binge on large amounts of foods and then purge, make yourself throw up, take laxatives or diuretics. So laxatives, to clean out your colon really fast, or diuretics to get rid of water. None of those are good for you. We often see low activity in the front part of the brain with that. We treat both these with a healthy diet, behavior therapy, supplements, and medication. ADHD, very common. It's associated with inattention. People are easily distracted. They tend to be disorganized. They procrastinate. I think of ADD or ADHD, I use those terms interchangeably, is erratic attention disorder. Often inattentive for regular, routine, everyday things, but for things that are new, novel, highly stimulating, or exciting, or frightening, they can pay attention just fine. So if they love something, they can do it. Unfortunately, most of school and most of life, you're not completely in love with, and those are the things where their attention span is really a problem. That's why it's inconsistent. Poor attention to detail, they may be or not hyperactive. About half the people who have ADD or ADHD are hyperactive, restless, often very impulsive. They don't think before they say things. They don't think before they do things. They can be really talkative. They tend to interrupt, and they're often excitement or conflict seeking. They're looking for ways to turn on their brain because it's usually associated with lower activity, especially in the frontal lobes, especially when they try to concentrate. So the top is rest, the bottom is when they're doing a concentration task. So you can see when they try to concentrate, the front part of their brain drops. What that means is the harder they try, the worse it gets. Sort of like putting your foot on the gas pedal, and rather than your car going faster, it goes slower. It so explains. I've had so many patients over the years tell me this explains exactly their experience. Having ADD is not a disorder of you're not trying hard enough. It's often you tried and it didn't work, and then you tried and it didn't work, and you tried and it didn't work, and then at some point you gave up and said to heck with it and stopped trying. On medication, this one on Adderall, you can see the brain works so much better with concentration. So for the right person, now again, ADD is not one thing. I wrote a book on it's 7 different things, but for the right type, medication can just make a dramatic difference in the person's life. So how do we help people with ADD or ADHD? Goal setting. Very important for you to know what you want. And then ask yourself every day, is my behavior getting me what I want? Intense exercise. So Michael Phelps, the famous Olympian, was diagnosed with ADD, was taking medicine for ADD until 6th grade, and then he decided he didn't want to take it anymore, and he treated himself with intense aerobic exercise. So the swimming was very important. A higher protein, lower simple carbohydrate diet. So we'll talk about the glycemic index. It's just how quickly does a food raise sugar for you. Fish oil. But the fish oil that seems to work is much higher in EPA than DHA. Dopamine is the neurotransmitter that helps with focus. It's actually what medicines like Ritalin and Adderall work on. It's also been found to increase with green tea. So having a couple of cups of green tea a day or using a green tea supplement may be helpful, along with medications like Ritalin, Adderall, Strattera, other medications that can be helpful. Tourette syndrome is a tic disorder. You might know someone who has it. They blink, have facial twitches. So they have motor tics, blinking, facial twitches, shrugging, head jerking, picking at their skin. along with vocal tics, such as coughing, making animal noises, whistling, puffing, blowing. Sometimes they might actually have involuntary swearing. It's called coprolalia, and it's highly associated with ADHD, obsessive compulsive disorder, and stuttering. So we often see the basal ganglia and cingulate gyrus work too hard. So anxious, worried, rigid, and flexible, along with the tics. We might use magnesium as a way to help. There's certain medications like clonidine that can be helpful. Exercise, fish oil, a healthy diet can lower the intensity of the tics. Anxiety disorders. People have panic attacks. And a panic attack is like you have just this horrible sense of impending doom. Your heart might race. You might have trouble breathing. You feel like you have to leave a situation or you're going to go crazy. Anxiety disorders, you often feel tense, nervous, fear of going crazy, fear of dying. Your heart races. You might be afraid of social situations. You might develop specific phobias like spiders or dogs or heights. You tend to avoid normal places. And it's often associated with physical symptoms like headaches or tummy aches. We often see increased activity in the basal ganglia. There's another area called the amygdala in the temporal lobes that is often very active in people who have anxiety disorders. And treatment for it, relaxation exercises, hand warming, breathing with your belly. So slow, deep breathing. And here's the secret. Take twice as long to exhale. So take a big breath, 3 or 4 seconds in, and then take 6 or 8, 10 seconds to blow it out. Hypnosis, very helpful for anxiety disorders. Meditation, getting rid of the ants or the automatic negative thoughts, a balanced, healthy diet, fish oil, and then calming supplements like magnesium, GABA, and L-theanine. There are some medications for anxiety. I'm not a huge fan of those. I would rather do all the other things before I put someone on anti-anxiety medications. What about conduct and oppositional defiant disorder? People have conduct disorder. They tend to steal, lie, break rules. They can be bullies, threaten other people, often get into fights. They may set fires. They use force on others. They often have low activity in the prefrontal cortex, which is why they have less empathy. Not everyone with a conduct disorder has problems as adults, but they're much more likely than others to have problems as adults, breaking rules, being in relationships where there's a lot of problems. Very important to get treated, and I actually think this is where one situation where trying to really understand their brains is very important. There's another group, more common, kids who have oppositional defiant disorder. They tend to be argumentative, they defy authority, they irritate or annoy other people on purpose, can be vindictive, they hold grudges, things don't go their way, they get really upset. And on scans, we often see they have high activity in the anterior cingulate gyrus. Typically, we use behavior therapy, parent training, diet, and it's amazing sometimes putting them on a gluten-free, corn-free, dairy-free diet and also take away artificial colors and preservatives can make a radical positive difference in these kids and adults. Sometimes we'll use supplements, particularly multiple vitamins and fish oil, because if you're low in omega-3 fatty acids or you're low in B vitamins or zinc and copper are out of balance in your brain, it can lead to behavior problems. Sometimes we'll use medication, although for me it's one of the last treatments. Although if someone has an underlying obsessive compulsive disorder, they may have oppositional defiant disorder too. Or if someone has an underlying ADD or ADHD, they may have a conduct problem, and treating those problems can often make their conduct and behavior much better. I just want to show you this image of Alzheimer's disease. I know it's not what happens for teenagers and young adults. It tends to happen at the other end of life. But a lot of the risk factors for Alzheimer's, and you may know somebody in your family, a grandfather, great-grandfather, grandmother, that might have it. But some of the risk factors actually occur in childhood and adolescence. So if you have a brain injury, that increases your risk. Alcoholism increases your risk. Having untreated ADHD or depression, obesity or diabetes increases your risk. So if you want to keep your brain healthy lifelong, you want to prevent this. So Alzheimer's disease is where people have serious thinking and memory problems with age. So the brain struggles, and it's common, but there is help available. All of us go through hard times. Get help if it's interfering with your happiness and your life. Remember what I said. On average, it's 11 years from the time a child first has a symptom of anxiety, depression, obsessiveness, attentional problems, serious mood swings, before they actually get help. Don't let that be you or your friends and the people you care about. Learning about this can make a radical positive difference in your life. What does this all mean? Your brain can struggle in many ways. Get help if you need it. Understanding this can help you take control. And as there are 4 circles of illness, biological, psychological, social, and spiritual, there are 4 circles of help. So biological, exercise, the right diet, supplements, medication; psychological, not believing every stupid thought you have, which we're going to talk about; social, hang out with healthy people, work on getting your relationships right; spiritual, really focus on your deepest sense of meaning and purpose. It can make a huge difference for you. Coming up, you're going to learn about how to eliminate automatic negative thoughts, how to boost your relationships by understanding the brain, and how to change your brain in a positive way and change your life. Stay with us.